Participate, engage, speak out, use your voice to be an effective advocate. The Voices in Advocacy podcast examines the diverse landscape of advocacy, exploring the ins and outs of building influence, driving change, and creating champion advocates. It's now time for the Voices in Advocacy podcast with your host, Roger Rickard.
Hello and welcome to the Voices in Advocacy podcast. I'm Roger Rickard, president and founder of Voices in Advocacy, where we work with organizations to inspire, educate, engage, and activate your supporters by turning them into effective, influential advocates. And this is the podcast dedicated to the art of advocacy. This podcast is for the people that work and engage in advocacy efforts for their organizations, be they corporations, associations, trade organizations, and nonprofit cause groups. If you're one of the people that work to build grassroots advocacy and grow your community of advocates, then you are in the right place. Now, let's get started. In today's episode, we speak with Erica Klinger, Senior Director of Marketing at the Association for Accessible Medicines and the advocacy arm of the generics and biosimilars industry, where she works to ensure greater patient access to generic and biosimilar treatment options. Erica uses emerging digital and social media marketing techniques to convene and educate a diverse group of stakeholders to achieve priority goals. Prior to joining AAM, Erica was the Director of Interactive Promotion and Strategy at St. Jude Children's Research Hospital. Erica, thank you and welcome to today's show.
Thank you, Roger, for the opportunity. I really am a big fan of what you're doing, and I think it's really going to be helpful for so many people out there.
Well, thank you very much. And I'm a fan of people like you that do the work to reach out to educate stakeholders on the important issues that matter the most to you. So let's roll right into this conversation. Tell us, first of all, about the mission of the Association of Accessible Medicines.
Well, our mission, I came to AAM about almost 5 years ago, and at that time we rebranded, and so we re-looked at our mission. And although, what we basically do is we represent the manufacturers of generics and biosimilars medicines, but more importantly, we advocate on behalf of patients that rely on our medicines every day. So our mission is really all about access. And access to affordable medicines is everything from affordability of those medicines to being able to, fill a medicine that is on the, being on the market. So access. And all types of medicines. So most of the people know generic medicines. They're 90% of prescriptions filled. I take them, you probably take them. Most people aren't even aware that they're taking a generic versus a brand name medicine. And so I think part of it is we're advocating and educating people about that. In short, I think of it as, most of us think of generics in the pill format that were prescribed. And the only difference between a generic and a brand name medicine is that the brand name medicine, they're doing all the research and then they have to promote the drug. So wonderful, big part of the pharmaceutical industry. And they're the ones that you typically see on the commercials. When that patent expires, then multiple generic manufacturers can come to market, duplicate that drug. It's all FDA approved, goes through all those approvals, it's safe, and they are more affordable, inherently more affordable because of that. And so that's why people rely on them every day.
And the patent typically lasts, 7 years after, or
it could start at 7 years, and that's a little bit of in our advocacy, depending on the drug. They all have different expiration dates. And what can happen is over time, the brand manufacturer could change that drug, maybe make it a different color, enhance it. And so it could actually, be, 30, 40 years until that drug comes to market. And sometimes there's never a generic for that drug. And so that's what we could talk about it a little bit later, but one of our big advocacy is around drug prices. So if there is only a brand name option, patients are going to be paying more. And we put out an annual report. It's called the Access and Savings Report. And so we run all the numbers from the prior year, and we find that, just in 2019, the average copay for a patient is $7 for someone on a generic medicine, compared to a brand name medicine, $56. So brands are great. If you need to take the brand and your physician prescribes the brand name drug, wonderful. A lot of our members create both generic and brand name drugs. But I think when it comes down to accessibility, that's where that price point comes in.
Yeah, and the affordability of that for the average consumer. So you keep bringing up access, and I love it because you have an advocacy program that's on the website that's called Speak Up for Access. And it encourages voters and patients to advocate with government at the federal and state level for accessible prescription drugs, but through storytelling.
Yes.
So how do you use this program to drive that engagement?
Yeah, people power is everything. And as you mentioned in my bio that, I worked at Seattle Foundation and St. Jude Children's Research Hospital. Well, I think of myself as just building engaged communities. And, AAM as the association are fairly, is trusted out there as a representative of their industry. But there is nothing better than it coming for the people that have that real life experience. So it's not just about the story, but, people's voice matters so much today. And with new channels and emerging channels, mobile, social media, look at the YouTubers out there. They have power and influence, the power and influence they have. And it's really just appealing. I guess we're pretty lucky, with the generics and biosimilars, because this directly impacts people as an immediate effect on their household and their disposable income. If you're giving to some charity or advocating for something that maybe is like, save the whales, which I love whales, I love the animals, but it doesn't directly maybe affect you right there in your home and your family. And so it's really about them, and they just need to be armed with the information and make it really easy for them to contact their lawmaker.
And the effect is more than just necessarily to the individual. It can affect the extended family based on how that impacts them financially. Within the family, you can others in the family that may not be on the medicines and may not be sick also can be impacted by that. You did talk about stakeholders, and I have a program I do called the 7 branches of the advocacy tree. And most people don't look at advocacy outside of the realm of necessarily government affairs, but on my advocacy tree, to fill out the entire tree, you've got government affairs, and you've got media, and you've got brand, and you've got cause, and you've got industry, and you've got public service, and you also have people. And so through your storytelling, you're using the power of the people. So in your role as marketing, what other channels are you using besides the patient necessarily and the storytelling there to help get the word out that you're trying to reach?
Yeah, and I think that, the patient story is one aspect. I think the other content that really is helpful, combining the two together, is the data and the storytelling. So when we think to getting out those resources, information, like I said, I just cited a few statistics. I would say on that side, when you're talking about channels, I think having those advocacy campaigns where you have a website or a microsite where it's really easy for lawmakers to find and download the information, that is great. I think when it comes at, we have things on the AAM website, we have campaign microsites, but then when we look at channels, especially now in this world we're living in the pandemic, we've found that where before we actually did, I like experiential campaigns. We actually created an experience to celebrate 35 years of generics medicines. And what we did was activate patients on the Hill and staffers that work on the Hill, people walking by Capitol Hill. We were set up in 2 different places outside, and we delivered over 1,500 different cupcakes we gave away, Georgetown cupcakes, just to engage with people. And then we actually delivered boxes of cupcakes to the original lawmakers that created, it's the Hatch-Waxman that kind of gave birth to the generics industry. And so without COVID, those kind of activations when you can actually be face-to-face is so important and probably the best way. But with the pandemic, we've gotten pretty creative with what we're doing right now. We're on a Zoom. All these emerging channels that people are using, one of them being, we're doing a campaign right now, and we're using Spotify. People listen to podcasts. So the great thing is, sometimes with ads, on the radio, kind of just, you're not even listening to them. They just kind of roll by. And many times on TV, people are, just recording and skipping by commercials. So if you can make it engaging, right now we're running a number of quizzes on Spotify. Did you know? Is it A, B, or C? and people
Wonderful.
like that. And if they do it multiple times, you phrase it that way, and then they can answer the question in terms of their life, whether they're a lawmaker or a patient, our member companies, it resonates with them, and they say, wow. And I think that's what we're going for, that moment when they're like, I didn't know that. Right. I'm going to go learn more. And then we got them. So we're not trying to go and use messages, especially now during the pandemic. We found that people just have too much information going on, and they want more positive information, too many negatives out there. So they're looking for solutions. So when we put it out there, we're putting it out in the fact of using the Spotify as a channel to engage them with a positive message, like learn more about solutions and better ways we can work together to make basically a better world for everyone, right?
Oh, I think that's great. And I think you're absolutely right. There's a lot of noise out there. So how do you find the way of cutting through that noise? Now, I know that you have an action center, the AAM Action Center, where you ask supporters to take action on specific issues. How does that work for you, and has it been an effective tool?
Oh, yeah, absolutely. When I came to AAM, we did not have any grassroots advocacy. We didn't, we're a small association. We have 30 people. So we do rely on a lot of allies, patient groups. We work with them. And so right off the bat, we started with acquiring people through campaigns. So we set up a campaign through our Action Center, and it could be state or federal level. So they could search for their state and find out what's happening near them, and they can take action. And what that tool allows them to do is either send an email or send a tweet or call their lawmaker. And it makes it really easy. And what we found, no matter what type of campaign you're seeing in there, it typically all kind of boils down to access or probably something drug pricing related. So we've learned that if it takes more than 3 sentences to try to sell them on what the issue is, you've lost them already. That's so right. Don't stand in their way. Just tell them that there is something happening right now that is going to impact you or your family in your state. And please send a message to your lawmaker. And what that tool does is already pre-gives them an information, so they don't have to know about the issue, and they can pre-see that message, which is fairly simple, and they agree with, and they hit send. And since I've started, we have over 20,000 advocates are now in our kind of database, and they've sent over 175,000 messages, either a call or a tweet or an email on the federal or state level.
Oh, that's outstanding. And then do you encourage your people to do any work in the field in district offices throughout the country?
Yeah, so we have a very talented team. Again, we're small, but kind of punch above our weight belt is kind of what our CEO talks about. And they are out on the ground. We have someone on the West Coast, we have someone on the East Coast, someone that manages in the middle. And so one of the things that's interesting is that grassroots does live on the marketing communications team. And so I'm working very, very closely with our state and federal affairs team. For example, just on the patient story side, prior to COVID, we had a kind of a man on the street, and we were actually doing a road trip up and down the Northeast in states that kind of had priority issues for us. And we would interview patients, and they would talk about, they just walked out of the pharmacy, and we would ask them, what did you fill your prescription for? And we know that 90% of prescriptions are filled for under $20 or less. So typically their answer is going to be, I love my generics. I hardly paid anything. My prices have not gone up. I love my generics. Please, lawmaker, don't do anything. Protect, my affordable generics. And so we work with them. We arm them with resources and information. So whether we have patient videos, whether I have infographics, whether it's stats from our report that it's drilled down by state. We have metrics about savings by each patient condition. And so when you're talking to a lawmaker in a state, they might be making legislation and it's well-intentioned. They might be trying to pass a law that they think is going to help patients. And that's where we have to engage them and just re-educate them and say, that's actually going to impact your access to in your patients in your state. And so just arming that with these data and statistics that is state specific is really helpful. We also find that when it comes down to grassroots, much easier to kind of make a difference at the state level than federal. I think you know all about that.
Yeah, absolutely. And I think you're absolutely right when you talked about the marketing role in grassroots advocacy, because a lot of the public policy people, they're really good at getting into the weeds. They're really good at understanding exactly what that legislation is going to do. But sometimes very difficult for them to put it in the layman type terms that allows the different stakeholder groups to take that and run with that. So tying it together. So your role then with marketing that is, well, how do you work that out? Do they come to you then and indicate, hey, this is going on here, there, or there? How do we message this correctly? How do we push this forward? Explain that a little bit for me.
Yeah, I just feel like one of the reasons I've stayed at AAM, because I think we really do have a very highly collaborative, integrated team that really appreciates each other's strengths. And so they are the ones that are looking out and moderating and making sure that there isn't anything that's going to impact patient access, or our members might flag, this is a problem. And that's it. They don't have to go in to share every little detail. Like I said, we can take it, and what we do fairly well, is kind of dumb that down. Now we do both grassroots and grass tops. So if we do communications and marketing, tweets, digital geofencing, that with a message directly to a lawmaker. We might even put things in a blog that we know that they're reading in the state. We'll create all that from our perspective, because we know and test, and that's one of I kind of have some guiding principles. I think with digital, being able to message and understand what messages resonate and work for both lawmakers and for the public, really important. So when I came on, that being one of my strengths, I actually manage a digital analytics team at St. Jude. And, when people open their eyes and see the data, they're like, I'm not going to try to rewrite that. And we'll test messages. So we'll come back to them with a proven tested message. And most of the time we're just switching out some basic information. And then if it's in a grassroots message, we're working very closely with our state team to make sure that one or two sentences asked to the lawmaker is very specific and on point. But everything else around it, what channel to put it in, what to say, we're testing into that. We don't have to, really be in the weeds on that.
Yeah, and when you're testing, you're probably not changing things very much. It's only minor tweaks,
Right.
but it reminds me of the poster Frank Luntz that has the book Words That Work, and how the difference in one word can absolutely change a perception in someone's mind of the issue, even though it may not technically change the meaning of it at all.
And it could be colors and images. I mean, part of my background is in creative. And so creative and education, and I'm doing marketing. And, it is all ties together because it's all about people's behavior, right? And one thing is you can't predict. And just because it worked like that last month doesn't mean it's going to work exactly like that the next month in that state.
That's
and
right.
Everybody's affected by what might be in the news that day. So I think the best approach is just always going out iteratively with a few different approaches, see what works best, and then rolling out, optimizing, and really pushing hard once you find what resonates with somebody.
That's right. It's a constantly moving target.
Absolutely.
Yeah.
And that people have such short attention spans. So, it's like banner violence. You get banner blindness, and you have to constantly be creative and innovative to grab people's attention. I'll tell you a crazy one that we did was we wanted, I mentioned the word biosimilars, and I think at the beginning you were like, what is a biosimilar? So biosimilar medicines, we represent biosimilars as well. They are the competitors to brand biologic medicines. And those are the ones that are actually, when you look down, when legislatures are trying to cut costs, it's the brand biologics in the pharmaceutical industry that cost a lot of money. So biosimilars have been around for a while. They're used around the whole world. In the United States, it's been slow on the uptake. There are some out, but they really have a huge opportunity for patients to, by having a competitor on the market, it just lowers drug prices altogether. But also biosimilars, people aren't really aware. They don't know they're taking a biosimilar. Your physician is just saying you're coming with this medicine. So to raise overall awareness and get people comfortable with the word biosimilar, we created for the 10th anniversary of biosimilars in the US from the BPCIA, which was the legislation, we did a 10-year anniversary campaign and created an Instagram and Snapchat lens or filter. When you're on a phone and you can change your hair to be purple or put glasses on, well, we actually did that. We created this app. We had a microsite, and it was called B10 Similars. And when they're on Instagram, they can click the link, put it towards their face, and create a selfie with a cool little glasses on, and then these hexagons with icons of medical things. And then it just basically engaged them in a different way to then click and learn more what a biosimilar is.
Excellent. Maybe I need to get on that app. So you talked earlier about your cupcake event that you had on Capitol Hill. Are you planning anything in the near term? I mean, we're starting to see the light at the end of the tunnel with the pandemic and things opening up a little bit more in different places. Do you have any events where your advocates can either gather to learn more about what's going on, or more about the next role of tactics that you can use to communicate your needs?
Sure. I think that, like you said, most of everything that we've been doing has really been very sensitive to what's happening right now in the world. But because of what's happening in the world has actually made some of our frontline workers kind of shine. So we've been sharing a lot, not only patients sharing their story for advocacy, but just showcasing our frontline workers that are behind the scenes creating those medicines. And so the two things that we're kind of highlighting right now, we actually have a microsite, securemeds.org, which outlines these two, I guess you can call them issues. One being the supply chain. I think we all weren't sure if we were going to get our toilet paper, but guess what? You were able to pick up your medicines at the pharmacy. You can go down to CVS and they were there. So we want to make sure that we have a strong and resilient supply chain for not only now, but whatever comes ahead. So there are some opportunities for Congress, for HHS to consider to make sure that patients will always have access to those medicines. Have to do with the supply chain, where they're coming from, just alleviating those issues. That's one part of it.
Well, and I was just going to ask you about the critical initiatives that you have as an organization. So I would assume then making sure that the supply chain stays intact and is sustainable throughout the process is a good thing for your organization. What else over let's say the next 12 months?
You just said the word sustainable. So sustainability. So I think that's the other half. We just put out a report, and it kind of lumps a bunch of things in there that we've already talked to for the previous administration, but it highlights all the ways that going forward we can have a sustainable marketplace. I did talk about some of the other prices, which are very low, but that necessarily, in our report, generics basically save the healthcare system $313 billion in a year. That adds a savings of $6 million a week. But those are huge numbers for lawmakers, right? And so we had to outline ways that we don't get those prices too low, that it doesn't make sense or it's not feasible for one of our companies to even compete in the marketplace. So right. Sustainability on those low costs are really important. And it does talk about biosimilars. I mean, if there's not a lot of biosimilars in the US, why? How can we, what are some of the things that we can do? What are incentives that we can do? How can we educate at a larger scale to make sure that people trust them and prescribe them? I was actually on a call with a patient. With the Zoom, we can still do patient stories. So her name is Akimi, and she actually is on a biosimilar. We have 3 patients that are getting featured in a report that we're releasing called Voices of Access, coming out next month. And we feature about 30 different patients, and one of them is Akimi, who is taking a biosimilar. She's has stage 4 cancer, but her quality of life, she had a lot of side effects from the chemo. And so she's taken the biosimilar to combat those side effects. And she's a huge ambassador for biosimilars because she's like, I can live my life. I'm a grandmother. She has kids. She's like, now I can get up and move. She's actually has an Instagram following, and she's an artist. And just watching her thrive is everything, and why I go to work every day. And so people like her and the report that we're going to put out hopefully entices people to go out and share their story about the supply chain, share how they received their meds during the pandemic, and please make sure that I can continue to do that. But also sustainability, just the everyday patient can go to our website, accessiblemeds.org. There's a take action button at the top, and it gives you a number of ways you can help. You can either go and take action on a current campaign, you can share your story, or you can just read and learn more about these resources and get educated, and then figure out, when it makes sense to go and contact your lawmaker.
Erica, you talked about one of the campaigns that you did where you kind of did the man on the street interviews as they were coming out of pharmaceuticals, and that I have done in different locations, asking people on the street this question. So I'm going to ask it of you. What is the first thing that comes to mind when you think of advocacy?
Oh boy. I would say people power. I just think that people, I don't know if you can ignore the voice and the strength of a person. So I think advocacy is about using your voice and using your voice in an effective way to help make change. There's other things that we do. Again, we meet with lawmakers. We have collaborations and partnerships, kind of getting a bunch of people to work together towards something with a lot of success. But I think you have to be your own advocate. You need to stand up and you need to get educated, and they need to see the passion and the motion come through. No matter what we're doing, lawmakers need to know how it's impacting people and their constituents, and they're not going to make change.
And it's interesting, depending on where you are, when I ask that question of an average individual, I often get lobbyists is the thing that comes to mind to them. And then I say, well, how do you feel about lobbyists? And then, and they often feel negative about them. And then I point out to them that the actual word advocacy is a positive word. It says to plead in favor of, to speak out for, and trying to educate people that the act of being an advocate is a really positive move is something that I become very passionate about. And you folks then take it to the next step where you specifically say, we need your powerful voice to do this, to say this, to help defend and protect what we know works in the right way for the people that need these type of medicines. So the president recently addressed the joint session of Congress and a long list of legislative proposals. Is there anything in that that you folks have been discussing about the impact that it could have on your organization and or the patients that rely on?
Yeah, I mean, again, I have some, those are for our policy and, affairs experts. But I would say anything in general with the new administration, they're considering how to cut prices, cut drug prices. So I think that there are a number of things that are being considered that are in our favor. So, I don't think that we have an issue with lawmakers understanding fundamentally that having more generics is going to lower drug prices for everyone. I think it's more making sure that they're not creating something that inadvertently affects, and it's, when their intention is good, but it might impact things the wrong way. So I wouldn't say there is one thing out there. I think it's just a number of things to keep aware. I think one of the things is because we're 90% of prescriptions filled, people don't think about the generics market. Our members actually work with us because they don't have, marketing departments. They don't have advertising budgets. They're not out there. I mean, if you have to pronounce the name of a generic drug, most of us can't even pronounce them. So we need just to be there to be a voice of the industry. Otherwise, we're ignored. We're taken for granted. They're like, oh, the generics will be fine. So, it's just more not maybe a single piece of legislation right now, but just keeping us top of mind.
So as we come to a close, I want to spin back to your role as marketing and running advocacy programs kind of with the visor of marketing on your head. What are your biggest challenges? And often is it time, is it staff bandwidth, or is it really something else?
There's always challenges. I mean, one where, inherently we don't have the budgets of the brand name pharmaceutical companies and those lobbyists. So I think that's always going to be a challenge across the board, is that even though most of the time we can be aligned on legislation, sometimes we are head to head and we just don't have advertising budgets to kind of combat with that. I think another challenge I don't think people even think about is the work from home, trying to contact on the marketing side, find people. Where are they? They're not, you can't just geofence a state capital anymore. They're not sitting there. So we have to be creative, new ways, new platforms, and also new ways. We can't just get on the street or create giving out more cupcakes to engage with people. We got to get them to trust us and get on a Zoom call. And so one of the things we did, if you go to our website and you click share your story, on that form at the bottom, on one click, you can either upload your video or just hit record. And so making it super simple, those technology challenges, it really impacts advocacy down to political ad restrictions when you can't do ads on Facebook, We have Apple and the iOS, if you have an iPhone like I do, people need to start opting in for advertising. So I think on the marketing perspective, those are challenges we're dealing with daily. We create this amazing, Instagram filter. We can't advertise it because it's talking loosely with the BPCIA that happened 10 years ago. There's a lot of challenges on the digital side that we work with. I just think that, being innovative, being able to react, coming up with innovative ways to overcome those challenges, sometimes, come up with something that's even better than you had at the beginning.
Yeah, let the creative juices flow there. So any final thoughts, anything you'd like to add, Erica?
I would just say, I'm just going to reiterate, I think we touched on all of them, but I kind of have some guiding, just a few guiding principles that, for other people listening that, really help me do my job. And I think it makes it more effective. One, always measure, use those data analytics, listening tools. People will tell you, go look at Facebook and read the comments. They'll basically help guide you on how you should talk to an advocate. Be prepared, but don't over prepare. You really need to stay nimble. You might need, we had something happening that, it's not like you get a really big heads up when some bill is going to get voted on that day. So you need to be ready. And so once we knew they were all gathering on the White House, and so we geo-fenced with advertising and got that up that day. And we were able to share with our members how many clicks we got to our resources. And I mean, that's just, you got to be nimble. I think collaboration makes you stronger. We have a very strong partnership with our government affairs team, our legal team, our allies and partnerships team. That's everything. We do not work in silos. We all work together. And I think that's really, really important. And then we also talked about just keeping the message simple. I mean, everything should loosely boil down to 1 or 2 sentences for impact. Right. Try to stick with that. If you're writing 5 pages on what your what your issue is, you're going to lose them. So
you're absolutely right. Simple. What great sound advice. Erica, how can people reach? I mean, I know you've listed a lot of things, and we will in our show notes list out a lot of the different sites that you listed here today. So how can people reach AAM for more information?
Well, I go to our website. It's accessiblemeds.org. All our social channels are also at Accessible Meds. So you don't have to do AAM or any, write out our long name. It's Accessible Meds. I mentioned biosimilars, biosimilarscouncil.org. If you want to learn more or engage with biosimilars, sign up for their bulletin, their newsletter. There's also one other thing I didn't mention, and it's a little bit more like, we engage patients and consumers, but we also engage people in the policy experts. So what we started about 2 years ago was a women in health policy group that is now over 700 members. So if you care about health policy, we invite all women, and it's open to men as well. We're just there, and our mission is to really help support women that want to learn more about healthcare policy. And you can find the group on LinkedIn. It's called WHIP for short, Women in Health Policy. And we invite you to join and learn more and engage, because it's not just about our industry. We want to work with other associations. We want to work with other healthcare associations. By us all coming together, we can really make a difference. So I guess the ask today is just get involved. Sign up for one of those things. Sign up for a newsletter. Follow our Facebook, follow our Twitter, and then see what happens.
That's great. Thank you very much, Erica. Now that's a wrap up of today's guest conversation with Erica Klinger, Senior Director of Marketing, the Association for Accessible Medicines. Thank you, Erica, for being on the show today.
Thank you, Roger. I really enjoyed it.
And now it's time for the Advocacy Engagement Tip. We always talk about having our advocates communicate with their elected officials. And to be effective in doing this, one has to learn a few guiding principles. Today's principle in meetings or phone calls with elected officials, keep it short and simple. Think about what you want and why you want it. Identify only one or two main points. Legislators will appreciate your respect for their busy schedules. Do you have a program to train and onboard any new advocates or reinforce advocacy best practices and principles to your existing grassroots advocates? We are proud to have Rap Index as a sponsor to the show. Let's face it, today's advocacy arena is just plain noisy. Organizations are stretched. You need every advantage to make sure your issue gets the attention it deserves and your voice heard. The Rap Index is the best way to do just that by finding your stakeholders' relationships and engagement power. Get past the noise. Know who your people know. Go to rapindex.com. That's RAP index.com and tell them Roger sent you for a special offer. A few quick notes to end this episode. In upcoming episodes, you will be treated to great interviews from leaders in the world of politics, associations, and nonprofit causes. If you like today's podcast, head over to where you find your podcasts and subscribe to the Voices in Advocacy podcast today. A big thank you to today's distinguished guest. We at Voices in Advocacy work with organizations to inspire, educate, engage, and activate your supporters by turning them into effective, influential advocates. That's it for this episode of the Voices in Advocacy. Remember, you have the power to be an effective, influential advocate. Now go out and make it a better world.
We hope you enjoyed today's Voices in Advocacy podcast and look forward to you joining us again next week. To learn more about Voices in Advocacy, go to our website, voicesinadvocacy.com.